Hey, it's Chris Bowling.
Chris Pine, good to see
What
you,
up,
CB.
CB? How are you?
Good,
We're
good.
still
We're
on still
continuing.
on Mental Health Week. Or I'm sorry, month.
Yes, we are.
Month.
Month,
It's not
yes.
just a week, it's a month.
So in the last week we talked about some of the investment in
Yes.
resources, but today I wanted to talk more from our HR and benefits team, helping your employees this month know what's available for them
Yes.
through your EAP. This is a really good time to do a mid-year education on the resources we have for mental health care. And, there's been some improvements from our telemedicine providers.
Yeah.
A lot of the virtual visits that were just, I guess, traditional medicine or dermatology are now including mental health, some at no cost. But also just, remind employees that you've got a crisis line dialing 988 if something is going on at the workplace. We've had some trainings on that ourselves that we're talking about how to identify a coworker in crisis. And,
Yeah.
I think that's just a good refresher, as you would do like a refresher on CPR procedures or fire drill or what you need to do in the event of an emergency. I think sharing this again so that coworkers know what to look for and then letting people know what their options are.
Yeah, we were having an issue with one of our kids. And once again, I've been doing this 34 years. Do you think I had a clue how to access mental health because we had never done it before?
Yeah. Yeah.
So it
No,
was
it's
It was going to HR. Carrie was working. She went to her HR to figure
yep.
out who do we call to just sit down with
And
a
have a conversation.
and
Yeah.
have a conversation about,
Yeah.
parenting adult children is difficult.
Yeah.
It's way different than
Certainly.
parenting a 2-year-old. And
Yes,
it
absolutely.
took us it took us days to figure out how do we access a
Yeah.
licensed healthcare professional to focus on counseling. That's really what we needed.
Yeah.
So
I know in some of our communities, we've got some freestanding behavioral health centers
we
that are not
do.
necessarily a healthcare system extension. They're their own entity. I think letting employees and their families know that these are available, that there is a spot where somebody can go that, yes, you can go to the ER, and I'm sure there's going to be resources there. It's expensive, but not every focus of the ER is to take care of mental health conditions,
Right.
so that I think you and I both have resources locally in our communities where you can walk in and receive care if it is a crisis situation. And, again, I think the good thing about this is that we're comfortable to speak about what we're going through.
Absolutely.
It's more top of mind in the last 5 years. But just like you said, do I remember what to do? It's back to putting material in front of the employee and their family so they know ahead of time what to do, because you won't think about it when you're in the middle of something. You're going to go back to whatever is most easy and most convenient. And if that's the case, maybe what's not the best fit for you.
Yeah. I mean, we put together a flyer for our clients, no different than how do you access healthcare? Think about telemedicine,
Yes.
think about convenient care, walk-in
Yeah.
clinics, urgent care. The last is
Yeah.
ER. We kind of did the same thing for mental health. Hey, if you just need to talk to somebody, here's where you can start. If it's a little bit more
Yeah.
severe, this is where you start. And here's the phone numbers. So for yes, those HR managers, benefit managers, now's a great time to put that flyer together or something to help that
Yeah.
employee know how do I access healthcare. Throw it out there on your,
Absolutely.
in an app, in your company intranet, whatever you got to do to make it easily accessible.
Yeah. Agreed. Sounds good,
For the
CB. Appreciate it.
refresher. All right, we'll see you, buddy.
Good to see you.
All right,
All right.
bye-bye.
Bye bye.